Hi, Mr. Williams. I'm Tara. I'm going to be your student nurse practitioner today.
Hi, nice to meet you.
How are you doing?
Good.
Good. What do you prefer to be called?
You can call me Jay.
Jack?
Jay.
Jay. Okay, Jay. And in terms of your gender, how do you identify yourself?
I'm a male.
Okay. And what gender pronouns do you prefer?
He.
Okay. And Jay, can you tell me a little bit about what brings you in today?
I'm in for my annual wellness assessment.
Okay, that's great. Well, to get started, I'm going to ask you some background information just so I can get to know you a little bit better, okay?
All right.
All right. As a kid, did you suffer from any childhood illnesses?
No, I was a regular kid. Just had chicken pox.
Yeah, I had chicken pox as well. Do you remember about how old you were when you had chicken pox?
Mm, probably 10 or 11, maybe.
Okay. Do you suffer from any high blood pressure or diabetes?
No, not high blood pressure, diabetes.
What about asthma or any kidney issues?
No, no asthma or kidney issues.
Okay. Have you ever been diagnosed with any health issues?
Just high cholesterol
Okay.
and obesity.
Okay. Well, how long ago were you diagnosed with the high cholesterol?
Um, that was about a year ago.
Okay. And are you taking medications currently for the high cholesterol?
Yeah, they got me on Lipitor.
Okay. Do you know what dose your Lipitor is?
Um, I'm not sure. It might be 40 milligrams. I'm not exactly sure offhand.
All right, that's fine. And do you take this every day, the
Yeah, they
Lipitor?
have me said to take it every day.
Okay. And have you ever had any surgeries?
No, I haven't had any surgeries.
Okay. Ever been hospitalized for any reason?
No, I've had ER visits, but never like
Like had an
overnight
overnight
stay.
stay?
Yeah.
Okay, that's cool. Do you have any allergies to any foods, medications, or latex?
No, no, I don't have any allergies.
Okay. Are you up to date on your immunizations?
Yeah.
Okay. And what medications are you currently taking? I know you told me the Lipitor, but besides that.
That's the only prescription one, but I take Tylenol sometimes if I have headaches or pains, and then I'll take Benadryl or Zoloft because sometimes I deal with like sinus drainage.
Okay. And your Tylenol, how many times a month would you say you're taking that?
It varies. It's not a set schedule.
Okay. And are you taking one or two tablets of when you take the Tylenol?
Um, I mean, really depends on the pain. I start off with one tablet.
Okay. And does
You
the
know, that's kind of
Tylenol?
what's recommended, so I just stick to that.
Okay, gotcha. And does the Tylenol seem to help with your headaches?
Yeah, it does.
Okay. And with your Benadryl as well, you're just kind of taking that as needed.
Yeah, yep,
Okay. And same with the Zyrtec?
yep.
Okay. Do those two seem to help your symptoms when you take them?
Sometimes they do, for the most part. You know, sometimes it seems like I take them and it don't really have an effect, but I still take them.
Okay. Yeah, the Zyrtec, I think that'll work better if you take it for a regular basis. If you take it daily, it might help you a little bit better. And what about any tobacco use?
Um, I smoke cigars maybe like once or twice a year.
Okay. And what about alcohol?
I probably drink about 3 or 4 times a month
Okay.
socially.
Okay. And do you do any vaping?
No, I'm doing vaping.
Okay. And what about any illegal street drugs like marijuana, heroin, or cocaine?
No, not at the moment.
Okay. Now we're gonna ask you some questions about your family history. Anybody in your family ever been diagnosed or deal with high blood pressure or diabetes?
My dad dealt with high blood pressure.
Okay. Um, did he take medication for it?
No, he
Okay.
was kind of born with it, is what the doctor told him. So the doctor told him as long as he didn't feel bad and just, monitor it and he'd be all right. So he never took medication.
Okay. And what about your mom? Anybody on that side of the family have
No,
anybody have any issues with cancer or strokes or heart attacks?
no,
Okay. And is your father living or deceased?
he's deceased.
Okay. Do you have any siblings that have any heart issue
I
or
don't have any siblings.
no siblings? Okay. And then what's your current housing situation?
I live alone.
Okay. And your highest level of education?
Graduate school. I finished graduate school.
Okay. And what do you do for work?
I work for a manufacturing company.
Okay. And how would you describe your physical activity level?
Uh, right now it's pretty low. I need to get in the gym more frequently, but I haven't made enough time for it lately.
Okay. And how many times would you like to go to the gym? Like how many days a
I
week?
mean, if it an ideal, maybe at least 3 days a week.
Okay. All right. Now I'm going to ask you some more specific questions. Have you ever dealt with or suffered from headaches?
Uh, Not really. Sometimes if I do catch a headache, it's usually a result of me being hungry or thirsty or something like
Okay.
that.
What about migraines? Have you ever
No, I
dealt with
never dealt with
migraines?
migraine.
Okay. What about any vision problems? Do you have any like blurred vision? Any spots in your vision?
No, my sight's really pretty good.
Okay. So no contacts or glasses then?
No,
Okay. And do you do like yearly eye exams?
no, not really.
Okay. What about eye pain? Do you have any pain in your eyes?
No.
Okay. What about your ears? Any issues with your ears?
Mhm.
No ringing in your ears? No drainage from your ears? Okay. And then what about your throat?
No
No sore
issues.
throat? No pain in your throat? Okay. And I know you mentioned sinus drainage. You do have that from your allergies.
Hmm.
Okay. And do you have suffer from any cough or shortness of breath?
No,
Okay. What about any wheezing or chest tightness? No. Okay. Any chest pain or palpitations? Feel like your heart's racing too fast?
no, pretty chill.
Okay. Any swelling in your arms or your legs?
No,
No. And what about your belly? Any issues there like abdominal pain, tenderness, or bloating?
no, just needing to lose weight. That's about it.
Okay. Do you suffer from any like constipation or diarrhea?
No,
No, your bowel movement's pretty regular for you.
yeah,
Do you have any nausea or heartburn?
mhm.
Do you ever get any indigestion or burping a lot?
No,
Okay.
just regular burping when I drink a soda.
Okay, yeah. Um, what about any trouble urinating, like any burning or itching when you go to the bathroom?
No,
Right. Any discharge from your private area? No. Okay. Do you have any frequency with your urination?
any frequency?
Like you feel like you have to go often or like
No, just normal. No, not really.
okay. Do you have any problems with like heat intolerance or being cold a lot?
Mm.
Okay. Some more questions about your skin. Do you have any rashes or open areas?
No.
No. Any dryness or itching? Okay. Any moles or birthmarks?
Mm.
Okay. And as far as pain, do you have any stiffness or joint pain that you suffer from?
Sometimes just like stiffness in my legs if I, do something too strenuous.
Yeah. Do you notice if it's a certain time of day or just kind of randomly?
Just random.
Okay.
Just depending on like it's typically after I do something strenuous or like a workout or something.
Okay. And have you ever had any injuries to your arms or legs?
Mm.
Ever broken any bones?
No broken bones.
Okay. Um, and as far as sexually activity, are you sexually active?
Yes.
Okay. Do you use protection?
Sometimes.
Okay. And have you ever had any sexually transmitted infections?
No.
Okay. Do you ever suffer from any dizziness or lightheadedness?
Mm.
Okay. Have you ever had any seizures?
No.
Experience any numbness or tingling in your hands, feet?
Mm.
No. Okay. And what about bleeding? Do you have ever had any abnormal bleeding or bruises anywhere of your body?
Mm.
Okay. And have anybody ever told you you've been diagnosed with like anemia, like a low blood count?
Mm.
You ever had any blood clots?
No.
Ever received a blood transfusion?
No.
Okay. And ever been diagnosed with anxiety or depression?
No.
No. Okay. And do you have any trouble falling asleep or staying asleep?
No, not really. I mean, I don't sleep for a long time, maybe 5 hours a night, 6 hours.
Okay.
About the most I get typically.
And do you feel well rested once you get up?
Pretty much.
Okay, well, that's good. Have you ever thought about harming yourself or others?
No.
Okay. Well, that just about wraps up everything I need to know. And I just wanted to summarize everything we talked about. It seems like you're doing well overall, but you had a few concerns with your weight and your sinus problems, and you do have the high cholesterol. It seems like you got that under control. You're taking your Lipitor for your cholesterol. I would continue that. And since the allergy over-the-counter allergy medicines are working for you, I would continue that as well. And then as far as your weight, I guess you can continue to focus on, you said working out, trying to get in the gym more often.
Eating healthier.
Yeah, eating healthier. Yep. All those things will benefit you. You know, it's not gonna fall off real quick, but it will take some time. But if you keep it up, you'll definitely get there.
Okay.
Okay. Well, is there anything else you want to talk about? Did we address all your concerns today?
I think so, yeah.
Okay. Well, it was nice meeting you. You take care and keep up the good work.
Thank you.
Thank you.